Good morning, everyone. This is a great day that we have all waited for a long time. Today we are announcing Alberta's Open for Summer plan. This is Alberta's three-stage plan to lift all public health restrictions and finally get our lives back to normal just in time for summer. 3 weeks ago, we asked Albertans to stop the spike. Thank you to all Albertans for rising to the challenge. The diligence and sacrifices of Albertans hasn't just stopped the spike, but crushed it. As a result, there are now under 11,000 active cases in the province today, a huge decline of more than 50% from the peak of over 25,000 active cases earlier this month. As a result, our hospitalizations and ICU admissions have stabilized and are coming down, with 548 in hospital as of today, down about 150 from only a week ago. Most critically, our intensive care numbers have also been coming down from 187 on May the 18th to 157 yesterday. To be clear, our health system remains under real pressure. And thank you again to our frontline workers for all that they've been coping with over this past year and through the third spike. But the good news is that with the leading indicators coming down, with vaccine protection coming up, and with the tailwind of summer weather and favorable seasonal conditions, we can confidently expect to see the pressure on our hospitals continue to come down. Our R value, which indicates how fast COVID is spreading, has fallen from 1.13 when our latest restrictions were announced about 3 weeks ago to just 0.67% today, which is very good news. We've also asked Albertans to step up and get vaccinated. And here again, Alberta, you're crushing it. Nearly 2.6 million doses have now been administered in our province, including more than 500,000 in just the last 2 weeks. The last 15 months have been incredibly tough. It's been a time filled with sacrifices and loss, adapting to sudden changes, and continuing on life in a different way. Many Albertans have lost loved ones to COVID-19 and many other causes and have been unable to grieve in normal ways. Many livelihoods have been hit hard, with jobs lost, businesses shuttered, and dreams dashed. But we've shown that we are Alberta strong, that we are tough, resilient, and compassionate. Today, we are truly near the end of this thing. We're leaving the darkest days of the pandemic behind and stepping into the warm light of summer. With Alberta's Open for Summer plan, a three-stage plan, we'll see all COVID-19 health restrictions lifted in only a few weeks' time, as long as Albertans keep doing the right things for just a little while longer. That means backyard barbecues, dream weddings, family reunions, concerts, festivals, birthday parties, dinner gatherings, and yes, the Calgary Stampede will be back on. In short, it means that finally getting back to normal, and I think it means the best Alberta summer ever. This is due in large part to the miracle of modern medicine, the COVID-19 vaccines. The vaccines are safe and the vaccines work. They save lives. They protect our hospitals. They are our ticket back to normal. In fact, recent polls show that 83% of Albertans have already been vaccinated or are planning to get vaccinated. And that is why Alberta's Open for Summer plan is based on getting more doses into more arms. Our three-stage plan is based on the percentage of Albertans who protect themselves and others by getting vaccinated. For the first two steps, the number of hospitalizations will also be taken into account just to make sure that we're protecting the healthcare system, which has been our central goal from the start. We're taking a province-wide approach. The rules will be the same for all regions, just as COVID-19 has been a reality in all regions. In a couple of minutes, Minister Chandra will go into the details, but here's an overview of how we're opening for summer. First, for the first two stages, we'll use a combination of benchmark of vaccinations and hospitalizations. Stage 1 will start 2 weeks after 50% of eligible Albertans have received at least one dose, when hospitalizations are at 800 and declining. Now, when I talk about eligible Albertans, I mean anyone born in 2009 or earlier, basically Albertans who are 12 years of age or older. And by the way, Alberta opened up that eligibility to that age more quickly than any other Canadian province. We're waiting 2 weeks, though, because it takes that long for vaccines to develop full protection against the virus. As I mentioned, we have less than 600 people in hospital today. I think right now it's 548 as of last night. And since we reached the 50% vaccination milestone on May 18th, that means that we'll enter stage 1 in the coming days. This stage will be a careful step forward. So let me be clear about that. We have to be prudent so that we keep driving cases and hospitalization pressure down, which will put us in a better position then to open up completely in just a few weeks. Starting this Friday, May 28th, Stage 1 will see the capacity limit for worship services increase to 15% of fire code occupancy across the province. I want to thank faith leaders and their congregants across Alberta for their patience and cooperation over these last 15 months. I know how the disruption of worship and faith gatherings has impaired the spiritual lives and health of so many. So I can't wait for our churches, synagogues, mosques, manders, and temples to once again be open to the vibrant communities of worship filled with Albertans exercising their constitutionally protected freedom of religion. On June the 1st, the rest of Stage 1 will kick in. This means larger outdoor social gatherings. Retail capacity will be able to increase to 15% of fire code occupancy at that point. Hair salons and other personal and wellness services will be able to start up by appointment. This is as of next Monday. Outdoor sports and limited outdoor patio dining will also be allowed, with tables of up to 4 in outdoor bars and restaurant patios. And let me just say a word of gratitude. I know that folks in the restaurant and hospitality sector have taken an unfair brunt of the burden of sacrifice in the past 16 months. I know that many invested in patios to provide service this spring. We regret that because of the spike there had to be an interruption, but we'll be back to a bright future for the hospitality sector as of this coming Monday. Stage 1 is good news, and it keeps people outdoors where it's safest. But Stage 1 is just the start. From there, we'll be moving to Stage 2 a couple of weeks after 60% of eligible Albertans have received their first vaccine dose. Now, based on our current bookings, we expect to hit that 60% mark sometime this week, perhaps as early as tomorrow, which puts us on track to start this Stage 2 in mid-June. We'll also be requiring that there be fewer than 500 COVID-19 patients in hospital, with 548 patients in hospital now, and that number declining rapidly. We expect to be well below 500 in hospital by mid-June. Stage 2 will be a big step forward. Libraries and movie theaters will reopen, Albertans can return to the gym, and large public outdoor gatherings can resume. Places of worship and retail will see higher capacity limits, going up to 1/3 of occupancy at that point. Restaurants will be able to welcome groups of up to 6, both indoors and outdoors, and the work from home order will be lifted, with sports, performance, and recreation activities all resuming. Now, some restrictions will be in place to continue keeping numbers down, driving them down further, so that we can then safely open up altogether. But things will really start to look and feel like normal again once we reach this stage. From there, we'll move into Stage 3. Our final stage of Alberta's Open for Summer plan, once there is at least 70% protection among eligible Albertans. Again, we'll wait 2 weeks after hitting this trigger to allow Albertans to develop immunity. No hospitalization threshold will apply at this stage, although we'll closely monitor the numbers. At this stage, most public health restrictions, including the ban on indoor social gatherings, will be history, and we'll be able to enjoy a truly great Alberta summer. Almost all health restrictions will be gone. The only exceptions will be the mandatory isolation period for people who have tested positive for COVID-19, of course, and some measures to protect those in continuing care and the hospitals. We are optimistic that we'll enter Stage 3 by early July. And what a great day that will be. Events like K-Days and Calgary Stampede can proceed at that point with full participation. Both kids and adults will be able to get outdoors and compete in the sports that they love. You'll be able to visit with family, friends, and neighbors, both outdoors and indoors. Restaurants and retail will be wide open, and there will be no capacity limits or gathering restrictions at that point. We'll also welcome back domestic and international visitors to Alberta to experience everything that our great province has to offer. But of course, the federal government will continue to have ultimate authority over international travel protocols. Now, since our Open for Summer plan is contingent on vaccinations, I want to take a few moments here to show our projections for vaccine uptake. Today, we sit at 58% of all Albertans over the age of 12 having received at least one dose. That's only 2%, or about 76,000 doses shy of our target for stage 2 reopening. So with almost 90,000 appointments booked for today and tomorrow, and taking into account a roughly 4 or 5% no-show rate that we've seen lately, we could hit that trigger as early as tomorrow. So that means Alberta would enter stage 2 on or about June the 10th, as long as hospitalizations are below 500, again, a target that trends can have us on track for. From stage 2, we would need to vaccinate another 380,000 Albertans over the age of 12 to reach the 70% first dose threshold for stage 3. Now, between May 27th and June 14th, we have 404,000 booked appointments. If these if these bookings hold, even taking projected no-shows into account, we could hit stage 3 with a fully open summer as early as June 28th. And let me just say this. If more Albertans book more vaccines more quickly, that date could even come more quickly as well. So that's just how close we might be, folks. But it's up to Albertans now. You can do your part to speed up the full reopening by getting vaccinated as soon as possible. We could be fully open in just a little over a month. So, of course, I know that every day with any restriction is hard on people, especially on small businesses. These job creators are the lifeblood of our province and our economy. And that is why, effective today, we are extending the application intake period for the Small and Medium-Sized Enterprise Relaunch Grant to June the 30th. This will give businesses more time to access this third round of funding and get it into the hands of those in need. Altogether, over $1 billion of support. With this latest $10,000 payment, eligible businesses may receive up to $30,000 to help with the costs of public health restrictions. And since we opened this program on April 23rd, this tranche of it, we've received over 15,000 applications, including many from the newly included categories of taxi services, ride shares, and hotels. And we'll also be extending the abatement of the hotel tourism levy to the end of June. This funding has helped thousands of businesses, and the program will continue to accept applications to ensure that money continues to flow to businesses that are in need. So if you qualify, please apply right now. We have your back and are here to help you. So for the rest of the province, let me end today by saying that this is our chance. Alberta's Open for Summer plan puts the power in the hands of each and every Albertan. Now is our time, Alberta. If large numbers of Albertans keep getting vaccinated and keep following all the public health orders and guidelines in the meantime, we'll reopen in just a matter of weeks. If you don't like the current restrictions, and who does, the best thing you can do to end them is to get vaccinated. It will help to keep you and your loved ones safe, and we'll stick it to COVID so we can all get our freedoms back fully. I know one thing, it's that Albertans never back down from a challenge. We've proven that time and time again over the past tough year. Now I'm presenting this challenge to you with our end goal as clear as day on the horizon. Get vaccinated, and get vaccinated as quick as you can. If you've had COVID-19, talk to your healthcare provider about still going and getting vaccinated. It will still help. Find that sphere of influence that we all have, from within the circle of your own family and friends to our workplaces, colleagues, and neighbors. Promote protection and help others to take this step too. I've heard of some people saying that they're going to get vaccinated, but they don't have time. Well, now is the time. Because now, more than ever, the ripple effects of your decision on vaccination goes far beyond you. It's not just about you. It's about your neighbors. It's about our whole society. It touches on the lives and will help all of us. So thank you. And with that very good news, I'll invite Minister Shandro to provide further details about Alberta's Open for Summer plan.
Thank you, Premier, and good morning, everyone. I'm so happy to be here to give further details on our Open for Summer plan. I know that today's announcement has been highly anticipated by Albertans for a long time, and we have faced waves and we've bent curves together. But today is truly different this time around. After fighting this virus with the tried and true practices of physical distancing, wearing masks, staying home when we're sick, we have a new tool in our fight, and it's having a big impact. The vaccines are here, and every day more Albertans are rolling up their sleeves to receive their shot. And thanks to these doses, the end of the pandemic is within our reach here in Alberta. The plan that we're announcing today is based on facts, it's based on statistics that we are seeing play out all over the world. We're able to watch other jurisdictions as they are navigating their post-pandemic plans, and they have helped to inform ours. But make no mistake, this is a plan that is tailor-made for us here in Alberta. As Premier just mentioned, we are tying the easing of restrictions in our Open for Summer plan to the number of Albertans protected and a decrease in hospitalization numbers. So we will begin stage one, starting very soon, as Premier said, thanks to the hard work of every Albertan. Provided that we continue to see hospitalizations decline, the capacity for worship services will increase on May 28th, as Premier said, to 15% of their fire code capacity. And that is for places of worship across the province. And that's just the start. And made a few days early to recognize the important weekend ceremonies that occur for many faiths. We will then move fully to stage one on Tuesday, July 1st. This will see the return of outdoor social gatherings of up to 10 people with distancing. Outdoor patio dining can resume, but there are limits. Dining parties are limited to 4 people per table, and they must be from the same household or the 2 close contacts for those who live alone. Outdoor physical, performance, and recreational activities will also be allowed in distance groups of up to 10 people, and this is for all ages. Outdoor structured youth sports, performance as well, and recreation training are allowed in distanced groups of up to 10 people. Retail services will be able to increase their capacity to 15% of their fire code occupancy, provided that the store can maintain the ability to distance. And all personal and wellness services can reopen by appointment only, just in time for those summer haircuts. Wedding ceremonies may occur indoors and outdoors with up to 10 people, including the couple, the officiant, witnesses, and photographer. Funeral ceremonies, indoors and outdoors, may have up to 20 people, not including the facility staff or the clergy. Funeral and wedding receptions remain prohibited all across the province for this stage one. And these are small, but they are real steps forward. Restrictions remain in all sectors, and masking and physical distancing rules may and must continue to apply. These rules are province-wide. There is no more regional approach. We are moving forward as one Alberta. Stage two will see a lot more restrictions eased. It will be a really exciting time. This will happen once, as Premier said, 60% of those who are eligible, and that's Albertans who are 12 and older, have been vaccinated for 2 weeks, and hospitalizations are below 500 and declining. So stage two, in this stage, restaurants and cafes and bars may seat tables with up to 6 people for indoor and outdoor service. And they won't need to be all from the same household now for stage two. Outdoor social gatherings and indoor and outdoor wedding ceremonies can increase to 20 people. Outdoor wedding and funeral receptions with up to 20 people are also permitted. Places of worship and retail will be allowed to expand their capacities to 1/3 of their fire code occupancy. Youth and adult team sports can resume their gameplay and their competitions. Day camps and play centers will be able to reopen with restrictions. Public indoor settings, so this is libraries, it's recreational centers, arenas, casinos, theaters, and galleries and bingo halls, they may also reopen with 1/3 capacity. Indoor fitness classes may resume, and gyms may reopen for solo and drop-in activities with 3-meter distancing. Post-secondary institutions can resume in-person classes. Personal services can resume their walk-in services. And a maximum of 150 people will be allowed at larger scale public outdoor gatherings such as concerts and festivals, and 1/3 capacity for mixed seating venues such as grandstands. And finally, in stage 2, the work from home order will be lifted, although working from home where it's possible will still be recommended. Stage 2 will also see a significant lifting of restrictions, but it is not quite back to normal. Masking and physical distancing rules will still apply throughout in stage 2. And nearly all the things that reopen will still have sector-specific restrictions that we will clearly outline as the day gets closer. The scale of stage 2 reopening might seem daunting, but we must not forget that in comparison to last year, we have vaccines and the protection that they give us on our side as we make our way to this stage. And based on the difference that we've made in our most vulnerable populations, we fully expect to make a difference in our general population as well. Now, on top of that, we will be monitoring hospitalization levels throughout and will not move to the next stage if those numbers give us any reason to have continued caution. As Premier mentioned, the timing for our reopening is up to all Albertans and their willingness to get a vaccine. Now, stage 3. Stage 3 is the final stage for our Open for Summer plan. And to reach there, at least 70% of Albertans who are eligible for a vaccine, that's a reminder, all Albertans who are 12 and over, have received 1 dose of vaccine. 2 weeks after that trigger, we will open stage 3. With more than 500,000 bookings already in place for the next month, we're hopeful that we will enter as a province stage 3 by the end of June. And with such widespread protection, this trigger is not tied to hospitalizations, but they will be closely monitored for any growth. And stage 3 will usher in normality finally. Most remaining restrictions will be lifted, certainly for outdoor activities. There will be some strong recommendations surrounding situations where distancing and masking might be the case, but generally we will see life return to normal. In stage 3, all gathering restrictions and business capacity limits will finally be limited or lifted. Only the isolation requirements for confirmed cases of COVID, as Premier said, and some measures in continuing care settings and hospitals will remain. And as Premier mentioned, we will be able to officially welcome back domestic and international travelers to this great province of ours. And throughout, we will remain transparent about where Alberta currently is. The recent relaunch of our interactive map that tracks the vaccination rates across the province is accessible to all. And we hope that it will help guide the decision-making of those who have not yet gone to get their doses of vaccine. And meanwhile, I would encourage Albertans to look to the future and keep your focus there. We have set out clear signs for moving forward, and these are goals that are achievable. But we need everybody in the province to be on board. So if you're protected, be public, be proud about it. Talk about how vaccination will move us out of the pandemic and allow us to once again see the people and do the things that we love. If you've had COVID-19, it's still important, as Premier said, to be vaccinated for better and longer lasting protection. If there's misinformation floating around in your community, offer good sources of information and correct the misinformation. If you're not convinced you should get a vaccine, talk to a trusted source. Talk to those who have gotten their doses. Talk to your doctor. Talk to your pharmacist. There are over 2 million Albertans who have now gotten a dose of vaccine who would be willing to talk to you about why they chose to get immunized. Our own website as well has a wealth of vaccine information that is continually being updated and available in 13 different languages. Just go to alberta.ca/COVID-19-vaccine. And Alberta Health Services has people who are available and willing to talk to you. Just please reach out and ask the questions that you have, get the correct information that you require. More than ever, we need you to take action. We need all of us to take action together. The speed of our reopening depends on it. And thank you. I'll now ask Minister Schweitzer to update you on the Small and Medium Enterprise Relaunch Grant.
Thank you so much, Minister Shandro, and thank you, Premier Kenney, for your remarks on this. I want to start by just acknowledging all the small businesses across Alberta that have made huge sacrifices for over a year now. We've held town halls, we've worked with medical professionals to talk to you about how we can safely keep your businesses open throughout this pandemic as much as possible. You've shared your frustrations. You've shared tears. You've shared anger, all of the things, and that frustration as your livelihoods were on the line throughout this pandemic. And it's with an immense amount of gratitude that all Albertans should say thank you. And we say thank you to you for everything that you have done throughout this pandemic to keep us healthy and to keep us safe. For the last 6 weeks, we've had the opportunity to meet with over 50 chambers of commerce and business organizations, and the feedback is resounding. The time is now. We need this clear path to an open summer, and it's time to get this going. It's time to have that done for Albertans, and we have to keep this going. Every single Albertan, if you haven't had that chance to get vaccinated yet, now's the time. Keep it going. We want to see this done. For all those hockey fans that are out there that have watched the Canadian playoffs versus the U.S. playoffs and just noticed that there's some pretty robust fanfare happening in the United States, keep it going. We need those vaccines on our shoulders right now. For the baseball fans that are out there that see the crowds that are happening, your kids will say, "Hey, Dad, why are there people in the crowd? Why can't we do that here?" Go get your shot. This is the time. Right now is exactly the time for all of us to step up and get this done. There's a clear roadmap, clear benchmarks. That's exactly what the business community and community leaders have been asking of us. We have that roadmap right now. We are weeks away from an open summer. We're weeks away from being able to turn the page on health restrictions. And we encourage every single person in Alberta, get out there, get the right information. There's trusted sources, as Minister Shandro has mentioned. Go to those trusted sources, find that information, and get vaccinated at the earliest opportunity. The vaccine supply is here now. Let's get this done for the future of our province. And talking about supports. Now, I hope this is the last time you hear me coming up to this podium to talk about business supports and grants related to COVID-19. So we're going to be extending the relaunch grant eligibility till the end of June. So if your business has been impacted by health orders and you've seen a drop of 30% of your revenue as a result, apply now. And I encourage people to Google 3 simple words: Biz, B-I-Z, Connect, and Alberta, and that will take you to the website where you can apply. Same application as the previous 2 rounds of the relaunch grant, same eligibility criteria, and it'll be open until the end of June. When it comes to our tourism industry, we know that you have been asked again to make big sacrifices throughout this pandemic. And we've heard loud and clear from hotels and the tourism industry that further supports are required. So that's why we've expanded the relaunch grant timing, as well as extending the tourism levy abatement until the end of June. That's needed to provide them with the supports and to give them the ability to get through to the other side of this pandemic. And I'm just going to close with that, again, that immense amount of gratitude to the small businesses across Alberta that made those sacrifices for all of us. And just thank you. Thank you from me, from my family, from all of us in government, for what you have done. And your message has been sent to us loud and clear that we need to be open this summer. We now have a clear roadmap to get that done. So Albertans, let's get it done and let's get going again this summer. Thank you so much.
We'll now go to the phones for questions. Just a reminder for those on the line that we'll do 2 questions each, either 2 off the top or 1 question and 1 follow-up. Operator, can you please put through our first caller?
First question is from Bill Fortier with CTV News. Go ahead, Bill.
Hi, I just want to ensure I understand this. And Premier, you said this is a province-wide approach. Rules are the same for all regions. So, you know, right now, for instance, high level is looking at like only 11.3% vaccination. So if the entire province reaches, 75% and everything opens up, but high level is still very low, isn't that dangerous for that area to open fully up with an exceptionally low rate of vaccination?
First, I'd have to take a look at that. I thought they were, pardon me, that local geographic area was more in the 20% range. Look, we're talking about the protection of the overall population here, about 4.5 million Albertans, and that's the science behind herd immunity when we look at the whole population. Obviously, we are concerned where there are pockets of below average vaccination. We will make special efforts to reach out in those communities with both information and vaccination opportunities that break down barriers. In some pockets of the province that have particularly young populations, like, for example, that's an area with a very high birth rate, so you're going to see the overall percentage vaccinated lagging that of the province. So we'll do what we can to encourage people in every part of the province to get vaccinated as quickly as they can. But let me be blunt, we don't want to get into a situation where we start shaming people or be seen as punishing people in a particular postal code or town or community because they're not getting vaccinated at the same rate. Overall, we're looking at the whole population here, and I believe every other province is tying their reopening, as have other countries, to population level immunity as opposed to local level immunity.
Premier, could I supplement that as well? Maybe just to say that this is something that the medical officers of health and the public health folks have looked at, including Dr. Hinshaw. And when we take a look at the community protection that we need to be able to move forward in reopening with this Open for Summer plan is looking at, there may be regional differences, but what we need to be doing is looking at the protection of the community as a whole. Now, there may be some pockets where there might be smaller levels of vaccination, and there might be cases in those areas as a result, but we want to be looking at what we want is for the cases, for the province as a whole, and how that translates into pressures on our health system. That's the focus here for us.
Yeah.
And the protection of the community of the province as a whole.
Yeah, exactly. So sorry to come back on this, but Tyler's exactly right that ultimately this is about keeping the pressure off our healthcare system, and if there's out of our 134, I believe, local geographic areas. If we have a couple of those within our small population areas with lower levels of vaccination, they're not going to constitute a meaningful threat to the capacity of the healthcare system.
And Bill, do you have a follow-up?
Yeah, quick one, and thanks very much for that last one, guys. And I guess looking ahead to a CFL season this summer, do you anticipate stands with 150 people, a third of capacity, or a full capacity inside Alberta stadiums?
As long as we hit these targets, which we anticipate doing by the beginning of July, it would be full capacity.
Operator, can you please put through our next caller?
Next question is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thanks for taking my question. Premier, I'm wondering why all of this is just tied to first doses. We've heard over and over that first doses are good, but you need the second dose to be protected. Why is the second dose not reflected at all in this?
Well, if you look at actually, when we say 70% first dose, that's our public-facing target. We want to keep it simple for people to aim towards, to unite around one big target that we can all focus on. Obviously, we wish we'd had broader second dose coverage by now, but because of the delays in federal procurement, we've ended up at a situation where we had to go long on the first doses. But you can see the health impact it is having. You can see how it is helping us, obviously, to keep one of the lower death rates of the large Canadian provinces, but also to be driving down hospitalization numbers now. We have looked very closely. Dr. Hinshaw and our public health team have studied very closely the experience of other jurisdictions with robust vaccination programs, places like, for example, Israel and the United Kingdom, various United States, and most of them went further on reopening at lower levels of population protection. So our public health team, in coming up with this policy framework, very closely assessed, but they weren't just looking at first dose protection. They were looking at what percentage of protection do you have from infection and from serious symptoms from the first dose, what protection do you have on the second dose, but also what percentage of the population have natural immunity. That's another important thing to add. We estimate that about 14% of Albertans have a degree of immunity through antibodies acquired through prior natural infection. So that helps to make up the protection gap, if you will, between first and second dose. And let me just say that fortunately Alberta does have the highest percentage of population having received a second dose amongst the Canadian provinces. We did go longer on the second doses, particularly with the most elderly and vulnerable at the beginning of our vaccine rollout in this winter and early spring. So we are at 9.2% of eligible population having received a second dose. That I believe it's 7.4% of total population. That's almost twice as high as the Canadian average. So once we start to see first dose demand begin to trail off, I suspect probably in the latter half of June we'll see the rate of booking start to decline. We will definitely use the supply to push forward the second doses as quickly as we can. The bottom line, I guess I'll try to simplify or summarize that, is the key public metric we're using, which is first dose, has beneath it a deeper analysis of what constitutes population protection, including the 9.2% with double doses, including the 14% with natural immunity.
And Premier, if I could supplement as well that answer, just to say, Kerry, that yes, when we came forward with these recommendations to EMCC, baked into our recommendations was looking at the data and looking at not just in what other jurisdictions were doing with their vaccine uptake, but also the vaccine. How should I say this? But the effectiveness, the vaccine efficacy for first dose. So knowing that percentage and knowing then the percentages of risk for infection in the community when we have the certain levels of not just the community protection from those who post-infection, but those who have had the vaccine, that's why we knew that we could have as stage 1, 50%, 60% for stage 2, 70% for stage 3, because of that vaccine efficacy. That's included in our calculations.
Kerry, do you have a follow-up?
Yes, thanks to both of you for answering that. One of the things I'm also curious about is when we look at Alberta and Manitoba as an example, they have about the same vaccination rate, but we see Manitoba having to fly some of its patients to ICUs in Ontario. Are you worried at all that Alberta runs this risk, a similar risk, even though we're dropping now?
Well, I would say clearly we're not concerned about that, or there's always some risk here. It's always been a question of managing risk, but the trajectory is very strongly in our favor. The wind is in our sails, as it were, between a combination of the public health measures we imposed 3 and 4 weeks ago, together with the impact of vaccinations. I think Manitoba got hit harder by variant spread later than Alberta did, so we saw widespread presence of the B117 variant here beginning in February. I think Manitoba's seen that happen later, and so we wouldn't be taking these measures if we thought that it would in any way jeopardize our healthcare system. I'll remind you, Manitoba apparently has reached their maximum capacity in terms of ICUs, having to ask other provinces to help them with some patients. We've never come close to that in Alberta, so because we took measures to prevent it. So just to remind you, we have our stretch capacity target for ICU admissions for COVID patients is 425. We appear to have hit the peak at about 186 about 10 days ago, and we're now down into the 160s and declining. So we have fairly significant flex capacity, if you will, within our healthcare system, and we're taking a very slow and measured approach here. I mean, we're taking the first measures here are the first measures to relax public health restrictions are pretty modest, so we can buy more time, and that's also why we're tying the first two stages to the level of hospitalization.
Operator, can you please put through our next caller?
Next is Michael King with Global News. Go ahead, Michael.
Michael, we can't hear you. You might be muted.
Hi there, Premier. A couple questions about stage 3 and some of the thresholds here. Why no?
Sorry, Michael, can you repeat your question from the start? I think we just had a poor connection there.
Hi there, Premier. A couple questions about stage 3. Why no hospitalization threshold there? And why are we looking at just hospitalizations, not ICUs, across all 3 stages?
Well, the key metric for pressure in the healthcare system overall is hospitalizations. The ratio between COVID admissions for acute care beds and ICU admissions has remained relatively constant throughout. It's a little higher for ICUs in the last month, but and also it's very important for us when we're putting out a policy framework like this to, as much as possible, keep it simple. Underline these two metrics of hospitalizations and first dose vaccination is a lot of other statistical analysis. For example, if you have 500 people in hospitals, how many does that imply in ICUs? And if you have 70% first dose vaccination, what does that imply for population protection generally with natural immunity second doses? So there's a lot of other analysis that underlies these top line numbers. We're confident that once we get below 500 acute care admissions for COVID-19 and declining, and we start to reach that, get into that threshold of community protection, community immunity at about 70%, based on international experience, we are confident that we'll be in a very good position. We're not flying blind on this. I guess one of the advantages of Canada having been a bit late to the party on vaccine supply is that we have been able to closely observe the real-world experience of other jurisdictions. I'll remind you that U.S. states like Texas opened completely, dropped all public health measures in one fell swoop. In their case, I believe in the second week of March, when they were at about 15% of first dose vaccine coverage. And they did have higher natural immunity, probably 30 to 40%. But states like Texas and Florida and many others completely dropped their public health measures at much lower levels of population protection than are built into Alberta's plan, and their numbers have continued to drop. We're not just looking at U.S. states, but we've seen similar trends again in places like UK and Israel. So it would be unprecedented in the global experience on COVID for a population at about 70% protection to see a surge in hospitalizations. I guess I would say it's not completely impossible based on the performance of variants that could pierce vaccines, but so far we have not seen those.
And Premier, if I could supplement that one as well. Premier, you're exactly right. By the time we get to 70%, then it just isn't required. But knowing that we are starting from a baseline where we still do need to be looking at hospitalizations, knowing that our cases are coming down, and we know that the hospitalizations will come down as we move in for those first 2 stages, it's important for us to continue to keep an eye on hospitalizations for those first 2 stages. But once we get to 70% of those eligible getting their vaccines, then it's no longer required. And that was the advice that we received from the public health officials.
Operator, can you please put through our next caller?
Next is Licia Corbella with Post Media. Go ahead, Licia.
Good afternoon, Premier. This might also be a question for Minister Shandro, but the question I have has been touched upon a little earlier and has been somewhat addressed, but I want to sort of bore down a little deeper into it. No other country in the world has as long a gap between first and second vaccination shots, and countrywide, only 4% of Canadians have been fully vaccinated. So we can't honestly say that these decisions to reopen are based on science, because no other country in the world has this long a gap between. So we don't know, for instance, whether somebody who was vaccinated in March, say an elderly person with 1 shot, is going to be protected if they start going out in public and people aren't wearing masks and that kind of thing if they don't have their second shot. So I guess my question is, since there isn't really real-world evidence with regard to this long a gap between first and second shots, is there a risk there? And what kind of evidence do you actually have that, outside of course AstraZeneca, because it's a 12-week span anyway, so what are you basing your reopening plan on with regard to these thresholds of first vaccines, in light of the fact that so many Canadians or Albertans will their immunity will have diminished after a 4-month wait?
Well, first of all, Licia, Alberta is leading Canada among the provinces in second dose coverage at 9.2% of the eligible population. That may be one of the reasons we are experiencing a lower death rate, in that we did go long in protecting the most elderly and vulnerable, for example, seniors living in congregate care settings, with that second dose. So we are almost twice as high as the national average for second dose coverage, which puts us in a good position when we're able to switch move the vaccine program to a greater emphasis on second dosing. Secondly, this is all based on analysis done by our public health experts on the efficacy of vaccine coverage, for both first and second doses. There are, as you know, a number of studies around the world on first dose effectiveness and the gaps. For example, the AstraZeneca, there's at least one study out of the United Kingdom indicating that a longer duration interval between first and second dose is actually more protective. And so this is critically important. It is clear that, in the case of the United Kingdom, for example, they've had a long interval between first and second dose on AstraZeneca, which has been their mainstay vaccine, and COVID has fallen almost off the charts in terms of a public health risk in the United Kingdom. So we will be catching up with second doses. I anticipate that we'll start in mid-June. As we see demand for first doses begin to abate, we'll begin to catch up with that second dose coverage to provide that full possible effectiveness. But you also need to factor in, as our public health experts do, the positive impact of natural protection, which is quite strong, coming from antibodies, and we estimate that constitutes about 14% of population. So right there, you've got 9% with second dose in Alberta, 14% we estimate with antibodies. That's 25%, plus 70% of eligible shortly with first dose protection, which is very meaningful protection. Altogether, that's what makes us confident that we can proceed. Tyler, do you want to add into that?
Yeah, it was, as you said, Premier, it is real-world data that we looked at in European countries as well as states in the United States. We do know the efficacy of the first dose. We know that it's not the full protection that we want. We still want people to get that second dose. But in looking at an open for summer plan, what is the coverage that we would need for the population as a whole for that first dose coverage, knowing that we still do want people to get that second dose. And so that was how we work backwards from that risk and from those numbers, knowing that there is protection after 2 weeks of that first dose. But obviously, you're right, Alicia, we do want people to still get those second doses as they become available.
And can I say, Alicia, I would refer you to a study that PHAC has done, Public Health Agency of Canada, or at least they've done a tabulation. Perhaps it's not a fully peer-reviewed published study at this point. I believe that they've identified 6,800 cases of people who received a first dose having subsequently become infected with COVID-19 in Canada. And that's out of over 20 million people who have received first doses. So that would further suggest that the risk is very low.
And do you have a follow-up question, Alicia?
Yeah, I do. This actually comes from a reader who's begged me to ask this. So wedding season is upon us, and so there are some people, so actually two readers asked me to do this. Weddings in, say, mid-June, you're saying that maybe by June 10th, they can go up to 20 people. So how strict, like, can they start, if say, June 10th is 10 people and June 12th is 20, if they're on the 11th, can they sort of go halfway, to 15 or something like that?
Tyler?
Well, the focus here for us in this Open for Summer plan is to make sure that we were moving as quickly as we could and trying to open stuff as in an accelerated way. But for us to do that, knowing that we are starting from still, I mean, it's great to see our cases coming down. We have half the number of actives right now than we saw at our peak. That's great news. But we have to also learn from countries like Hungary when they started their opening plans, when they still had a high baseline in their hospitalizations and their cases. So that's why we are still looking at the hospitalizations, knowing that we still are going to thankfully see the cases continue to come down in the coming weeks. And that is going to allow us to have a more aggressive stage 3 rather than having more stages and having, less stuff in stage 2 and stage 3. We really need to get those cases down to a baseline where we can have that aggressive full opening in end of June, early July for stage 3. So that's the focus, and that's unfortunately the consequences of the spike that we saw in the spring here in Alberta.
All right, we have time for 2 more questions. Operator, can you please put through our second last caller?
This is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Premier and Ministers. First question, talking about reader questions, is Premier, with all of this good news that you've announced today, what do you visualize the Calgary Stampede looking like? In other words, the normal Stampede has pancake breakfasts, it has a parade, it has the Nashville North Tent, it has the rides, it has the rodeo, and you yourself also can have a Stampede breakfast. How much of that is going to be possible given the reopening plan that you just announced?
Well, if we hit these targets, as we think we will, it'll all be possible. I do think, Rick, the only constraint will just be timing, because as you know, a lot of those great community groups have the whole spring, spend months preparing those events, and some of them may have missed the window. I just said to my staff last night, knowing where we were going with today's announcement, let's think about doing a Premier's pancake breakfast. We hadn't planned on it, but let's see if we can put one together in a few weeks' time. So I encourage community groups to start planning towards that if they'd like to. I think there will be, I'll tell you, I'd love to be in the griddle rental business in Calgary today. There's going to be some pretty good business, I think, for those sorts of events. And gosh knows, people in the events industry, they need a little bit of business. They need some love. They've been largely shut down for 15 months. I'll refer some of the questions, I guess, to the Stampede as to what exactly they're planning on doing, but they did announce 2 weeks back that they do plan on having a Stampede. We've been working closely with them. I saw there was a city councillor in Calgary last week doing a pretty typical Twitter attack on the government, supposedly for not working with major events. Nothing could be further from the truth. The major events group over at the Public Health Division have been working daily with groups like the Calgary Stampede over the past several months to plan out various different kinds of contingencies and to give them some guidelines. But we didn't know for sure when we could pull the trigger until we started see the numbers really coming down like now, and the vaccine numbers really going up. So we're now in the position to give people this degree of certainty so they can plan. I do know there will be a rodeo at the very least, because we worked with the feds to get exemptions on or relaxations on quarantine requirements for foreign rodeo performers that are going to be headed north. I think Mayor Nenshi told me that there won't be a permit for the Calgary Stampede Parade, but maybe instead the Stampede will have a scaled down parade on the Stampede grounds. But the bottom line is this: Conklin is coming, as I understand it, for the Midway. The Cowboys are coming for the rodeo. And I'm sure the young Canadians and all of the local performers are geared up. They may have some challenge booking talent. That's one of the reasons I understand the Edmonton Folk Fest had to cancel this summer, is because they need months to write these contracts with uncertainty about federal quarantine requirements. They didn't have the confidence to do that. But in terms of public health restrictions, I fully anticipate we'll have as much Stampede as the community can put on.
And do you have a follow-up, Brick? Oh, go right ahead.
Yes, and the follow-up is on masks. When in this plan do you anticipate the province-wide compulsory mask law to no longer be on the books? And what happens if certain city councils, I won't mention any names at this point, persist in keeping a city mask? What will you be talking to them if they say, I don't care if the province is taking the masks off, we're gonna keep them on? So just on that two-part question dealing with masks, when will masks no longer be the law, and what happens if cities persist in making it the law in their jurisdiction?
Thanks, Rick. Well, they've never been required outdoors, and we would be lifting the indoor mask requirement province-wide as part of the final phase here, late June, early July. Dr. Hinshaw may come in with a recommendation for mask use in certain work contexts. Obviously, long-term care, hospitals goes without saying, and we'll wait to see what her recommendation is as a potential additional safety measure for some people in some contexts indoors. But we certainly won't have one outdoors. And I would hope and expect that cities and municipal councils would follow the province's lead on this in other respects. Tyler, do you want to add anything to that?
No, I think you got it, Premier. Nothing else to add to that. As Premier said, stage 3, we would be anticipating then at that point that any of the mask requirements that we have as a province would be lifted. And as Premier said, there may be some situations like long-term care, obviously for health protocols and those types of facilities. That may still be the case, but for mask mandates provincially, that they would be lifted at stage 3.
Operator, can you please put through our final caller?
Final question is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Good afternoon, Premier. Thank you for taking my question. And as usual, I'd like to hear you in English and in French, please. The speed of the plan is quite high. We see only 2 weeks between each measure. And doctors have also warned that we should wait after weekends like the one we just had with May long weekend to see the effect of gatherings that could potentially push the new cases up. So why such a high speed for reopening?
Well, I would say, Audrey, I don't think many Albertans will feel that this is high speed. We've been at this for 16 months with incredibly tough measures that have interrupted people's lives, that have cost a lot of sacrifice and adversity. So to just maintain these measures indefinitely when we are beginning to approach population immunity, while the COVID numbers are dropping very quickly, would, I think, be irresponsible. I think at some point people will just, even more broadly, start to ignore rules. But we are taking a cautious approach. You know, when we brought in the most recent round of public health restrictions, we said that we would wait 3 weeks to see their full effectiveness, and we are waiting that full 3 weeks. We are building in between each one of these stages a couple of weeks between each anticipated step forward, again, to take a cautious approach. And this is a far more cautious approach than, for example, many U.S. states have taken. One of the reasons we have to be more cautious is we have more limited healthcare capacity. We are tying hospitalization numbers into the first 2 stages, again, to take a cautious approach. And I've seen some of those doctors talking, or those individuals you're citing, talking about their concern on variants. You know, in particular, they're talking about the Indian variant, B1617. So far, we have identified 29 cases of B1617 variant in Alberta. We were very concerned, I would say 2 months ago, about the so-called Brazilian P1 variant, but we've so far identified only 2,400 cases. Obviously, the B17 UK variant took hold much earlier on. But the point is that as these numbers come down, we are able to do more robust testing, and including full genome sequencing of suspected variant cases. We have greater flex capacity in our robust contact tracing system, so we can test, trace, isolate. We will, when we see outbreaks, local outbreaks, for example, be able to take a very targeted approach, because even with population protection, even if we get to 80% of the population fully vaccinated, the virus will continue to circulate, and so we'll continue to have a degree of vigilance. So all of those public health measures will apply, but in a very targeted way, without causing massive damage to our broader society. So I'll try to say that more briefly in French. Écoutez, notre plan d'ouvrir l'Alberta pour l'été est très prudent. Nous avons attendu 3 semaines depuis les mesures de santé publique annoncées plus tôt, et nous voyons que les chiffres diminuent quotidiennement. La pression sur les hôpitaux est en train de diminuer considérablement. Et en même temps, nous voyons une croissance incroyable dans le pourcentage de la population qui ont reçu la protection des vaccins. Alors, on est confiant quand nous voyons l'expérience mondiale de toutes les autres juridictions. Nous croyons que notre plan est très prudent, et nous pouvons agir à l'avenir pour s'adresser les problèmes locaux quand ils arrivent d'une façon très ciblée.
And do you have a follow-up, Audrey?
Yes, please. There seems to be quite a big jump in the measures listed between stage 2 and stage 3, which is almost full reopening. But we're also basing the plan only on vaccination rates for the third phase. So isn't that a big jump? Also considering the fact that a first dose is not full immunity if you have a 2-dose vaccine?
So I'll try to respond. I think a similar question was asked by Licia Corbella. In fact, our public metric of first dose vaccines at 70% of eligible population has beneath it a deeper analysis of population protection. We acknowledge that you don't get full protectiveness out of a first dose, but we also have to factor in the strong protection that about 14% of the population has through prior infection and the antibodies that they got, as well as the 9% of eligible population who have second doses. And that number will start to go up. So you take population, natural immunity, you take that group, you take the fully second dosed group, and then you add on considerable protection for people with first doses, and we estimate that we get to about 70% effective population protection by the end of June, beginning of July. And there's not a jurisdiction on earth so far in this pandemic which has achieved something in the range of 70% population protection that has not succeeded in bringing the virus largely under control. I'll try to say that in French. C'est pas excusez-moi. Notre approche n'est pas basée seulement sur, I'll do that again. Notre approche n'est pas basée seulement sur les premières doses de vaccins, mais sur une analyse plus profonde de la protection de la population. Ça comprend, par exemple, le 9% des Albertans éligibles qui ont reçu une deuxième dose, et ce nombre-là va augmenter. Et ça comprend le 14% de la population avec, qui ont été déjà infectés et qui ont les antibodies pour se protéger contre la maladie. Alors, quand nous considérons tous ces facteurs-là, nous croyons que environ 70% des Albertans auront la protection effective contre la pandémie par la fin de juin, le début de juillet, et toutes les juridictions au monde qui ont arrivé à un tel niveau de protection de population ont été sauvegardées contre la pandémie. So thank you very much, folks. I appreciate it. By the way, unfortunately, Dr. Hinshaw had today booked off as a personal day quite some time ago. We've just made these decisions yesterday, and so we wanted to announce them, but she'll be here to answer additional questions, especially more technical questions that you may have tomorrow. Thank you very much.